Welcome to the new reality of securing healthcare. I'm Jeanette Wider, and I'm the managing editor of Healthcare Innovation. So today we have Richard, Esmond, and Michael with us, and I'd like to begin by asking you guys to introduce yourselves. Richard, why don't you begin?
Yeah, thank you, Jeanette. So I'm Richard Stainings. I'm Chief Security Strategist of Cylera. I also teach at the University of Denver, courses in healthcare informatics and cybersecurity. I've been around the healthcare cybersecurity space in excess of 25 years and served on quite a number of committees for HIMSS, CHIME, AHIS, you name it. So this is my forte. Glad to be here today. Thank you for inviting me.
Great. Esmond?
Thank you, guys. My name is Esmond Kane. I'm the Chief Information Security Officer for Stewart Healthcare. Stewart Healthcare is a multinational healthcare delivery organization. We're in about 9 states domestically and 3 countries internationally. We serve tens of millions of patients annually. And it's unfortunate right now that some of our locales are frontline in some of the COVID hotspots that we see across the country right now. But thank you for inviting me. I look forward to the conversation.
And finally, Michael.
Hi, Michael Katz. I'm a cybersecurity specialist at Infoblox. I've been, in the security realm for many years. I ran my own email security company for 8 years and have had roles at Cisco, Juniper, Anomaly, a number of others, in the cybersecurity industry.
Great. So as we all know, the cybersecurity landscape is a little wild right now, and the threat vectors are intensifying, and frankly, the bad guys are getting badder, right? So I'm thinking we could start a conversation about the importance of building a good foundation. Michael, what are some of the simple things that people may have overlooked that might make significant impact?
Well, I spend a lot of time, meeting with cyber teams of all sizes, right? Most sophisticated to small hospitals that have a few people covering many different systems. And the biggest issue that I run into, there's 2 really. There's one, not a lot of framework for what people are making decisions around, so they tend to follow vendor claims and things like this, and going for more complex solutions when they don't have a firm set of goals for the foundation for how they're going to build the service. And the other one really is around data management, right? You can have the best detection tools in the planet and they can tell you something's wrong, but if you don't have the staff that's able to react and figure out that this really is a signal that matters, all the signals in the world don't make a difference. So I really try to, help teams, again, look for a framework to make decisions from, and to start with things that you can control that are simple, right? Sometimes, looking at the basic digital foundational elements like an IP address or a name, right, can be an excellent place to start your security as you move to more complex tools. So really, I think you have to look at that foundation as the beginning of your cyber posture and then move into more complexity from there.
Right. Richard or Esmond, do you have anything to add about foundational basics?
Esmond, why don't you go first?
Sure. I think one of the complexities we're involved with in healthcare is we're overcoming some debt that we've accrued through the decades and the delivery associated with healthcare. We've accrued a lot of legacy systems. There's a lot of OT that's frontline in dealing with patient care that perhaps isn't where it needs to be. So, I'd echo some of what you just heard from Michael there. A lot of this is foundational security controls. It's back to the basics. It's making sure that simple things like good identity management, good hygiene, good antivirus, and fast SOC and SIM. So, there's elements there. I'd also echo from Michael that you can't manage what you don't measure. So the goal with healthcare is obviously patient care, right? But to that end, you need to be managing and measuring how you're delivering that patient care from. And a good security metrics program is essential to make sure that you're tracking those risk reduction measures that you're taking, that all these different speculative plays that align with these frameworks like high trust or these other kinds of ones are actually having an impact. And you're not just throwing money at a wall, which is an expensive proposition at the best of times. So yes, I would agree. Focus on the metrics, focus on the basics, make sure that you have a good solid foundation to build upon. And there's a huge element of that we'll talk about shortly around the human element, the human firewall as well.
Right. And I'll build upon that, on what both Esmond and Michael said. It's important that we follow a security framework. Obviously, in the US, we tend to follow, in the healthcare space anyway, we tend to follow the NIST CSF, the cybersecurity framework. And that is really the first part of your building block for your cybersecurity management program. You need a holistic security. There's no point spending your entire security budget on an impregnable front door if you can't afford window locks, right? And we in this space, as Esmond mentioned, have a lot of historic debt. We've underfunded cybersecurity and healthcare for 20 plus years, which is why we're an easy target right now, which is why you're seeing the number of attacks. But it also comes down to understanding what assets we have on our network, right? We've grown our medical device numbers on healthcare networks exponentially over the last 10 years. They now account for at least 3/4 of most IP connected assets. And most hospital systems have no idea what connects to their network or what risks those devices pose to the integrity of the network or to patient safety. Don't forget, medical devices are attached at one end to the network and often at the other end at a patient. Right? And this is where we find ourselves today, in that we're not just protecting valuable assets like PHI and PII, which is the historical foundation of security in healthcare, thanks to HIPAA and other regulations, but we're actually trying to maintain the integrity of healthcare data and the availability of healthcare systems against growing attacks from perpetrators, whoever they may be.
Great, those were great answers from all of you. So building on what we were talking about, Michael, how can an organization use its existing infrastructure as part of its cybersecurity strategy?
Well, it's not so easy to go out and acquire new technology, right? Even if you have the budget, getting the SMEs, building it into your processes and things like that is very difficult. One of the things that I work with, Infoblox customers and in general, just all types of people really, is to make use of the services that are already running your digital foundation and building them into your security processes, into your automation, your detection, your audit workflows. That could be DNS, it could be your directory, it could be your IPAM system, it could be, even your networking equipment. But the point is trying to bring in the services that are already running to the cyber architecture before you start investing in new things. And eventually, essentially, like we saw with Facebook yesterday, it wasn't necessarily a security problem, but I think everybody that works in security would be in the hot seat if that happened in their environment, where the foundational services caused you to go offline and caused you to, ultimately affect patient care and affect, your own functioning, your own job performance, right? So I think before you make those big investments, you want to make sure you understand what's the core services that make up your digital foundation and try to plug those services into your cyber detection, automation, response systems, so you can really make that foundation part of your cyber architecture.
Right. Do either of you have anything to add?
I'll start and I'll let Richard take up there. There's a huge element of what we just heard from Michael there around optimizing your existing investments. Hopefully you're communicating to your board, you've got some statistics that you're mining that speak to telemetry and risk. And hopefully you're communicating them to the board, you're educating your board on what visibility you have, or building a case to address any blind spots or gaps in your current weaponry. But the other important thing that Mike spoke to there is it's not just technology. There's also a huge element here around people and process. It's far too easy to point at particular headlines, but I agree with Michael, that recent one with a very prominent social media company was around inadequate due diligence around a change, right? So there's a lot to be said for having good people, which is very hard to do in the current marketplace, and keep good cybersecurity staff and attract them. But also there's a lot to be said for aligning your program with particular frameworks that might have a process that you can co-opt or make into a lean, hopefully eventually get to automation and streamlining. But certainly there's also a huge element here, which is just strategic partnerships with your vendors and making sure that they're helping and not being a hindrance.
Yeah, I'll just add to that. You know, healthcare is undergoing a massive change right now, perhaps more so than ever in its history. We've got digital interoperability. We've got, you know, a massive growth in AI and ML-based systems. And these are having to work alongside legacy applications, you know. So, you know, we've got some integration challenges here that, you know, that Michael and Esmond talked about. It's not easy. It's not rocket science either, but there's a degree of due diligence that we need to be doing as, you know, security leaders in the space. And we need to be communicating that effectively up the food chain to our CEOs and boards of directors and making sure that they understand the complexity of what's taking place and allocate the right resources, whether that's, you know, budgets for tools and technology, or whether it's for you know, humans that can control these systems. But I think we've got to navigate carefully. If it were simple, then, you know, anyone could do it, and rather than you know, us being paid the big money, as it were, to solve these problems one day, he said, hopefully. But anyway, there you go.
Right. Michael, do you want to expand on what kind of internal controls can help fight against ransomware, which seems to be every day when I read the news and it's everywhere?
Well, yeah. So I was looking at the Verizon breach report, right, and especially the healthcare breakout section, right? 92% of ransomware is financially motivated from organized crime, right? So and a lot of that is automated. You know, they may pick an industry because they know that they have a higher likelihood of getting paid, but, you know, people's individual organizations are a lot of times just a victim of automated, you know, algorithms that find weaknesses that they can exploit and fit the business model. So I think it's critical that when you find, you know, you have to have detection so you can, you know, find either anomalous behavior or signatures of malware and things. But one of the big mistakes that I see people making is an over-reliance on cloud services for ransomware protections, because it's excellent to know that there's a ransomware indicator that a cloud service may have found, you know, external to your organization, but ultimately, you know, ransomware is going a lot of different directions at a lot of times, right? And a ransomware attack, or the actual malware that actually does the encryption and things like this, is part of a bigger family of malware, right? There's malware that gets you in, there's malware that gets you access to companies, to get, you know, systems. It goes laterally. So the point is, you have to take internal action, right? You have to be sure that you can isolate devices as quickly as possible when you detect them. No, if the signal's from cloud or it's from internal or from, you know, any place, you need to be able to take an internal control. And I see a lot of companies investing a lot in cloud services. And again, it's only going to solve a small piece of the ransomware problem. It may show you something's happened, but you need to isolate the proliferation of, you know, the associative malware families of a ransomware attack as quickly as possible. So, you know, I say bring your detection, bring your containment as close to the patient as possible, so you can isolate, you know, in multiple places, in cloud and internally. And that becomes very hard, right, when you get into IoT, which is prevalent in healthcare, right, where you have devices that don't have full stacks. They couldn't load the latest EDR client, you know, but you still need a capability to isolate them internally before they start doing damage east and west to your directory servers, principalers, et cetera. So that's really the key thing, right, is, you know, if you can find to have cloud, but bring your containment, detection, everything internal to the network.
Right. Richard or Esmond, anything to add?
I'll go next if you like. So I think I wanted to pick up on something Michael said there, which is really talking about containment, right? You know, network segmentation is an obvious compensating security control that we can apply for devices that cannot be secured by traditional, you know, managed IT asset means, right? And hospitals tend to have very large open flat networks, and they were built on the premise of a medical practitioner, be that a physician or a nurse, having access to whatever system they need, whenever they need it, in order to render care to patients and save lives, right? And we're never going to change that, nor would we want to. But at the same time, we want to restrict the ability of malware, particularly worm-like malware that gets on our networks, from spreading and taking down the entire system, right? So we need to start locking down at a granular access, who has access to what, zero trust, right? Or object level access, like, managing our medical devices and other IoT assets, so that they can only communicate on predetermined ports and protocols to predetermined destination IP addresses, and they suddenly can't start chirping out HTTPS requests out to C2 servers in Russia or other parts of the world where the bad guys live, as it were. So I think that's one thing. The other point I wanted to pick up is really prevention, and that really comes down to better security education, training, and awareness for our users. Any of the reports you read out there, I know before is probably the best known, but all of them all group their findings between 88 and 92% of successful cyber attacks start with a phishing attempt, right? So you can put the biggest barriers in place, the best firewalls, the best perimeter controls, the best anti-malware protection, but it's not going to get past Bob that likes to click on attachments without thinking about it and opens those things, and before you know it, you've got a dropper on your network that's chirping out and doing nasty things. So we need to do a much better job of preventing the droppers and malware getting onto our networks, and encouraging our users to think before they click.
If I can add to what I just heard there from Richard and Michael, I'm 100% agreement. But I'd also add that there's an element here of inevitability, that you will be compromised. And certainly a lot of teams are orienting themselves towards assuming compromise when they do have issues. When you see the relative sophistication of the attackers, they're doing big game hunting, and they're taking down organizations that I certainly would anticipate would have well-funded and well-resourced teams, and they're still falling susceptible to some of these attacks, whether it's the energy sector or some of the tech sector. You're seeing big names in the headlines that these ransomware actors are taking down. So it's relative sophistication. So I encourage you to focus on resiliency. That those basic hygiene measures that we heard out of Richard and Michael there, there's a lot to be said for good backup and having that backup isolated from your network. There's a lot to be said for those identity protections that are the root of some of those lateral movements that we heard as well. And definitely I echo, there's nothing like good phishing education, because, the goal with an attacker is to kind of be an insider threat, to impersonate your users. Once they're impersonating a user, perhaps to elevate to an admin, and once they have admin, to use some of your own systems against you. I think 60% of most recent attacks are not using malware. They're just living off the land and using your own infrastructure against you. And as we heard out of Richard and Michael there, some of the infrastructure that healthcare is dealing with isn't perhaps well maintained, or you don't have some of those detective controls. So to go back to the earlier point, there's a lot to be said to measuring, collecting that telemetry, and then responding quickly, when the bad things happen.
Richard, can you share about the latest trends that you're hearing from around the world and the level of preparedness or lack thereof that you're seeing among senior healthcare IT leaders in patient care organizations?
Yeah, thank you, Janet. I would say that we, despite a media onslaught for the last 10 years of healthcare entities being attacked, senior executives still aren't prioritizing security to the level that they need to be right now. And some of that has obviously been the result of the reorganization of healthcare under COVID, right? We've tended to pivot from providing services to patients that generate revenue to ones that are more responsive in nature, dealing with ERs full of unvaccinated people that come down with COVID, right? And you know, a hospital I was in last week, everyone in the ER was unvaccinated, right? So these are things that we can do to solve problems. I'm not going to get into the politics of vaccination or anything like that, but it's been a major distraction to healthcare. And as a result, a lot of security budgets have had to be curtailed because of the pivot towards, you know, making other infrastructure changes around HVAC, right? Making all our ICU rooms air negative, right? So that we can contain the spread of pandemic diseases, for example, and bringing in new medical devices with long leads so that they can be monitored, patients can be monitored from outside the room rather than expose nurses to, you know, pandemic air inside of the room. So there's been a lot of reallocation of resources, but our leadership still aren't prioritizing to the level that they need to be. Now, I think at the same time, there's also been a rapid ramp up, as you mentioned in your initial comment, Jeanette, of the levels of attack, the levels and sophistications of attack. We have highly sophisticated adversaries here, and they only need to be successful once. We as cyber defenders need to be successful 100% of the time to keep the bad guys out of the network. And we've got thousands of endpoints that we need to manage. They just need to find one weak endpoint, whether that's an IP address or whether it's a user, in order to exercise a successful attack. So we need to do a much better job of sponsorship of cybersecurity, and we need to really understand and convince our leaders of the magnitude of these attacks, right? This is sophisticated nation state actors with hundreds of thousands of paid state employees that are breaking into our health systems, and tens of thousands of highly organized, highly sophisticated, highly skilled freelance organized crime hackers that are intent on monetizing whatever they can and have no ethics, no morals about who they endanger as a result of holding a hospital to ransom. And we're beginning to see patient deaths now. So this is serious, and you know, our executives need to start getting serious about this problem too.
Right. I want to circle back a little bit later to talk about how we can get some of the C-suite on board. But I feel like you're talking about, you know, ramping up and everything's getting crazy. It's a good segue. Maybe we could talk about the impact of supply chain attacks. And Esmond, what's your experience with supply chain attacks and their impact?
Yeah, so I mean, I think we just heard a pretty scary picture that Richard had painted there, and you know, the bad guys' sophistication is outpacing the good guys right now. You know, it's unprecedented times. When we needed healthcare the most, it's never been stressed, both by the nature of the care we're dealing with, but also this cyber pandemic that mapped to the actual real pandemic. So it was already going through a digital disruption. It was already massively adopting some of these cloud services. And when COVID came along, a lot of what healthcare had to do was to accelerate its existing momentum. And some of the statistics that you get out of HIMSS and such are that, in general, a lot of industries accelerated their cloud adoption by 3 to 7 years. If you were obviously a less mature organization, it was probably closer towards the 7-year. But the issue with doing that, as we heard from Richard and Michael earlier, is you need to place trust appropriately. And then when you're placing trust, hopefully you're verifying that it has been earned. So the sad news when you're reading about, you know, whether it's SolarWinds or Kaseya or these various attacks that are grabbing the headlines, is, you know, the bad guys don't have to go against you anymore. Now they have to compromise some of your supply chain. This isn't new. You know, they've been doing this for a long time. They've been doing diversions of medical equipment. They've been trying to divert some of our wire transactions and things of that nature. But now, in order to compromise your systems, the infrastructure that you've put in place to help administer and overcome some of these obstacles or challenges in managing this complex environment, now the bad guys are going against that. And when they're compromising your cloud provider, or they're compromising your endpoint management or your endpoint hygiene provider, or indeed your multi-factor as well, they're inherently creating an environment where your defense in depth becomes more complex. You're creating this spiraling exponential increase in complexity. And, you know, a lot of healthcare is still struggling to resource and to put the right people, process, and tools in play. And all of a sudden now you're undermining some of that strategic outsourcing. So it's certainly been a chore. There's a lot to be said for third-party risk management, not stopping at just the third party, but also extending into fourth and fifth parties. So you know that the composition that your supply chain is also bringing to bear from a risk management perspective. But inherently, it goes back to something that we've all been talking about through this panel. It's around good risk management. And management doesn't necessarily mean elimination. It means that you're reducing it to an acceptable level, that you're putting the right appropriate mitigations in play for your supply chain, but also that, you know, when you're thinking about zero trust, it's that you're validating, you're verifying that you're placing it appropriately.
Right. So do any of you have any advice on the continued evolution of these threats for organizations? I know we talked about foundation before, which is super important, and I hear that all the time, but would you like to tell our audience anything else?
I'll take some of that. So the ransomware guys, as we heard Richard speak to earlier, are very well funded, very well monetized. They're able to throw potentially thousands of bad guys against your infrastructure. And, you know, they're very capable of creating noise over here when the bad guys are actually going over here and taking down your systems, right? So there's multiple teams that are going against you, right? But the complexity there is also that they're changing what they're doing. It's not just disrupting your business. It's not just encrypting everything that comprises your infrastructure, your data center, your endpoints, your OT. They're also starting to steal your data. And now they're creating like double extortion or triple extortion kind of scenarios where they're stealing your data and they're putting it out there. And if you refuse to pay, now they're demanding or threatening that they will go directly to your patients and scare them into paying. We're also seeing that at the federal level, they're starting to chase the money trail here, which I think is hopefully going to be beneficial. So that some of these crypto exchanges and some of these transactions are long-lived and they're not as anonymous as some of the bad guys would like them to be. So, you know, in tandem with the supply chain, we're seeing some action or recognition at the federal level, both through executive orders and things like HR 5898, which are hopefully positive indicators, and indeed some measures out of the FDA recently as well, that indicate that the feds are listening, and hopefully they will help healthcare overcome some of these governance challenges and funding challenges that we heard Richard speak to earlier.
Right, Michael, do you have? Oh, I'm sorry. Go ahead. Go ahead.
Well, I was going to jump in there. I was just going to say we're also seeing some direct action from, you know, the US federal government taking out some of the known C2 servers, right? We've seen a number of bad actors that have been essentially either persuaded to go offline or are being taken offline by various actions from federal authorities. And I think we're going to see a steady increase in that to make their lives difficult. I foresee also that we will start going after the service providers, the hosters, right? The organizations where these perpetrators host their servers. And obviously, you know, some of those are going to have to be legitimate for them to kick things off, but many of the servers that are being compromised are actually owned by others. So they'll be going after those organizations and telling them, you need to patch your systems because, you know, you're being used as a proxy for cybercrime.
Michael?
Yeah, I think, you know, a lot of the, you know, there's a couple different issues there that they discussed, but I mean, for the boards need to understand this is a business model, right? This is a business problem from a hacker's perspective. They're not thinking, how am I going to hurt your patient? You know, how am I going to make somebody, you know, not get an MRI today or hurt their device or something? They're just thinking, how am I going to make money? They know in the US, you know, in a lot of places, healthcare funds are readily available, and people are going to do a lot to keep healthcare facilities running. If you just Google probability-based hacking or probability models for hacking, you can see pretty quickly, even if you're not a math person, which I'm not, unfortunately, that, you know, a lot of these businesses are built on the same types of models that any other business is built upon. So when you get to these targeted attacks, they're not looking at you, they're looking at a sector. And that to me changes the frame of the discussion, because you're not like thinking, why is my hospital the victim, right, of this? No, why is anybody targeting us? They're not, they're targeting the sector. No matter the sophistication of the attacks, the basic vectors are going to be similar. They're looking to steal data, they're looking to encrypt data, they're looking to shut down things and get money, right? So your defenses have to start sort of from, you know, what's your most critical assets, and make sure that you're protecting those and you understand the risks of them, and that they're implemented in a way that even if they do get in, because like somebody said, you know, is it the whole basis for zero trust is you have to assume breach all the time, right? So even if they are in, which we assume they are in today's risk models, that you're minimizing the impact of what they can actually do. So I think it's impressing upon people that's a business model, it's not personal, that you have to control, you know what's important to your business, regardless of what anybody's doing and trying to get access to, you know what's going to be important to healthcare. So you have to approach, you know, from the what you can control first, secure that before you're going to what you can't control, because you can't secure against, you know, thousands of unknown variables, but you can, you know, secure that key data and assets that you know exist. And you know, I think that as in terms of the third party risk, you know, I think that it's important to tie that understanding into your third party risk agreements. You know, there's a tendency to, you know, everybody has these agreements that they give to their vendors. Hey, you know, there's different names for the risk questionnaires, but everybody has them. They're expensive to monitor. You know, they're expensive. It's hard to really tell. I don't think if, you know, without bringing up names, but you know, these large IPAM companies or large nobody ever wrote down on their risk questionnaires, hey, we're not really you know, doing these things that we say we are. But you do have to have some methodology to validate a little bit of what people put down in their risk questionnaires, enough to make sure that companies know that they can't just, you know, fudge what they're telling, you know, healthcare organizations. So, you know, a little bit of validation, I think, could probably go a long way to evaluating third-party risk. So that's my basic ideas.
Great, great. So I think this is a good segue into talking a little bit about cyber insurance. And I've written a few articles recently about the topic, but do any of our panelists have any thoughts on PostScript's changes in the cyber insurance market? Esmond, do you want to start this one?
Yeah, I mean, some of this is organic. I think some organizations that got hit with ransomware leveraged their cyber insurance to pay off the bad guys. So I think in the PostScript's reality, or indeed the post-UVM reality, or UHS, there's been some changes around that profile. There's been threats of class actions and other kinds of things. There's also been obviously the federal government you know, trying to ban that. So the cyber insurers are kind of stuck in between, right? They're doing their best to try and encourage their customers to improve and mature some of the security posture. They're starting to mandate goals that I haven't seen before until quite recently. Sometimes they're overly prescriptive. I don't think that helps. They shouldn't be asking for particular vendors. They should be asking for particular defenses around that defense in depth spectrum. But certainly, I do think you're seeing cyber insurers exit the marketplace. I do think you're seeing some pressure from the regulators and the federal government to kind of forbid some of these payments, to mandate some of that reporting. And I do think that the insurers are starting to ask a lot more of their customers. So some of that is good, some of that is bad. I think they created some of the problem. But I mean, if you look at some of these sophisticated ransomware actors, they know how much your insurance is, and they ask for that exact amount. And then they will turn around and say, and by the way, if you start involving any negotiators to negotiate down, you know, they'll start adding in penalties. You know, the ransomware actors are also giving you cruddy tools that don't help decrypt sometimes, or they're slow. So the insurers are kind of stuck in between of trying to get the business back on its feet, and leverage this insurance, which is supposed to be for this black swan or low frequency, high impact kind of event. But as Forbes recently announced, it's more of a gray rhino. It's a problem that everybody sees coming, and they still can't get out of the way of this juggernaut, this large beast coming towards you. So I have high hopes that the federal space will encourage the insurers to do more. I'm hoping that they're passing that down to their customers, and I'm hoping that healthcare also steps up and adopts these frameworks that encourage you to be a lot more proactive, to focus on some of these risk mitigations. But in the meantime, the insurers are exiting the marketplace.
Right. Richard or Michael, do you have any thoughts?
Yeah, I'll chime in here if you like. So the jury, in my opinion, is kind of out on the benefits of cyber insurance, right? Is it a good thing? Is it a bad thing? Now, when it started out, it was considered a good thing because it allowed you to put some money aside, or to access it if you needed it, to cover things like legal costs, forensic investigation, restitution, these sorts of things. But it's become, as Esmond says now, it's become a mechanism to drive up the price of ransom claims, right? So we haven't reached the point yet where insurance explicitly forbids the payment of ransoms, or mediators who are going to negotiate that. But at the same time, I think there's a positive aspect here in that it's causing organizations to have to meet the requirements of insurers, which are some due diligence requirements, where it's SOC 2, requiring SOC 2 attestation of all of your third-party vendors, for example, or whether it's conducting or responding to audit questions about the types of security controls you have in place, so that premiums can be minimized. But I would expect premiums to go through the roof, to continue to go through the roof over the next few years. And there comes a point where companies need to ask themselves, is this money well spent? Am I better off spending the money up front for preventative controls or responsive controls to restore my system when it goes down? Is it more feasible for me to have a warm cloud standby with all of my applications running in it that I can switch over to, rather than have to spend days restoring data from backup tapes? So there are some questions that we in the industry need to ask ourselves, and I think this will be an evolving space, quite frankly.
Yeah, I mean, if you look at auto insurance, right? People don't drive drunk more frequently because they know they have car insurance, so they get in an accident, right? The risks to you if you get caught, besides going to jail, your name could be in the paper, things like this, right? So insurance, cyber insurance, like you were saying, in the beginning, it seemed like a really good idea, but like a lot of the customers I'm working with, you're better off looking at the requirements for cyber insurance and making sure that you're working within the models that they prescribe, and taking the recommendations before you decide what level you're going to invest in, because the reputational damage to your organization can't really be fixed with an insurance payment. So you really have to look at, they're asking for increasingly more controls that are more expensive to implement, like Richard was saying with SOC 2 and things like this. See what you can do about those requirements before you make that major investment. And I think you have to just understand there's only a limit to, they may get your data back, but they're not going to undo the damage that's done to your organization and frankly to your personal brand as well. When things go really south. So yeah, not a panacea.
Right. That's all very interesting. One thing I keep hearing is that it's just not enough to check the boxes on the cyber insurance. You really have to be doing the things you're required to do instead of just signing off on it. So I want to switch gears a little bit and talk about how IoT devices are just in every aspect of our daily lives right now. Do you have any advice for our audience and healthcare organizations, security professionals who monitor these devices and the endpoints?
I'll start. So the issue with IoT right now is some of that technical debt that was coming up earlier, but also it's the communication or the understanding that there's a shared responsibility. You know, in a lot of healthcare organizations, the people responsible for managing OT may not even report in an IT capacity. It may be through a different line of reporting. So you may have to influence and encourage, you know, adoption and best practice rather than being able to mandate. There's definitely some encouraging moves happening at the FDA level to understand that there's a separation or a lack of understanding between the manufacturers and you know, some of the hospitals around that shared responsibility. I definitely am seeing some encouraging signs from some of the larger manufacturers to create a more secure life cycle and to be a lot more proactive in this space, in particular around things like vulnerability management and responsible disclosure, which is not something we'd seen up until quite recently. So there's definitely some encouraging moves there, but also, as Richard had indicated, there's just this explosion in the number of devices. You know, depending on who you read, we're talking, I think, 25 billion or so devices any minute now are going to be connected to the internet. And if you look at the outage yesterday associated with this major social media vendor, the interesting thing was what happened for all of these connected devices. There was kind of this default denial of service connection or a condition where when all of these smart devices were trying to phone home, it was creating this denial of service, and it was creating these bandwidth constraints. So I do think there's a lot of work still need to be done in IoT. I do think it's heartening to see you know, HHS and these other bodies like OCR and FDA start to ask and demand a lot more granularity and a lot better hygiene from these vendors. But I do think there's a lot of value, to go back to the earlier conversation, around partnering with a strategic vendor who specializes in this healthcare IoT and these medical devices. You know, it's not just in the hospital. We're not on a journey just to a smart hospital. We're also dealing with the connected health. And, you know, we're still struggling to overcome some of the work from home challenges. And now our patients are now accustomed to having the convenience of care in the home with some of these consumer level tech devices, whether it's a particular watch that's monitoring your oxygen levels or your heart rate. There's an expectation that we need to do more, that we've accelerated the momentum of this digital disruption. And I think OT is at the forefront, where it's having benefits. It's making healthcare a lot more convenient for the consumer, the patient. And I think it's a journey that we shouldn't reverse. If anything, it's been one of the bright outcomes of COVID was, you know, how healthcare is a little bit more convenient for the patient.
Yeah,
Michael or Richard?
I mean, one thing I'll just add is the most common incidents that I'm involved in, you know, when I get called in, generally are outbound. It's something got taken over and it's doing something to somebody else. It may not even to you. And with IoT, that's been particularly big with some of the big McMurray and things like this, these big botnet attacks. And so, you know, I would say, you know, like Edmund was saying, a lot of times these devices come in from third parties, and sometimes they're managed by third parties. So there's a little bit of a hands-off approach, you know, because somebody else is managing those risks. But I think in general, you know, you need to look at managing outbound security in a much different way than people are looking at. You know, denial of service. You know, I talk to a lot of people. They spend all their money on outbound protection, inbound denial of service concerns. And like I said, most of the things that I see are outbound. Your IoT devices are attacking somebody else outside of your organization. So I think technologically, you know, you have to understand behavior and outbound flows. And, you know, from a business perspective, I don't think you can wash your hands of the risks that these devices bring just because somebody else is managing them. And, you know, lastly, I would, you know, go back to the foundational idea that you can't always load an agent on these devices, but you can certainly look at their name queries. You look at their movement around the network. If there shouldn't be any, if you see, you know, things that are curious, you can, you know, flag them. So understanding, you know, behavior and looking again at those basic signals if you don't really have the capability of putting advanced monitoring tools on these systems.
Yeah, so I'll chime in here. I mean, this is plainly a complex problem, right? And it's one that we haven't got in front of as an industry yet. Device manufacturers never designed security into the vast majority of these systems. They were designed purely for functionality, and no consideration was given as to the risks that they may present to, you know, the integrity of the network as a potential for establishing a foothold on the healthcare network, or the damage it may cause to patients if compromised. And we all know that, you know, there's some pretty horror stories out there going back to, you know, some of the Barnaby Jack demonstrations a decade ago of how you can assassinate a patient via a medical device that's connected to them, whether it's an implanted medical device like an insulin pump or a pacemaker, and or whether it's a directly network connected device like an insulin pump, or, you know, a radiography system, right? So, you know, we've had a few issues along the way that have caused us to reconsider the security risk here, despite, you know, security researchers being in our faces about these risks for a long time and no one doing anything about it. I refer to the, you know, the Muddy Waters case a few years ago, which resulted in the FDA getting off of its backside and finally, you know, going about taking a particular heinous medical device manufacturer to task over their lack of security, and it resulted in the first ever FDA recall of a medical device. Of course, this was a pacemaker, so they weren't technically recalled, but patients were required to go into their doctor and have the software updated on the device embedded in their chest. How many of those devices were actually, you know, updated is a good question that someone really should be asking. I've certainly looked into it and not found anything yet. So, you know, we have a legacy problem, right? We have millions and millions of medical devices that are on our networks right now that are 10, 15, sometimes 20 years old, that are not benefiting from the new requirements around security. And we've got to do something about it, right? And we can't go back and, you know, as Mike said, we can't go back in and add supplicants to these devices because they don't have the capacity. Often we can't even update the out-of-date embedded operating systems that are on these devices because there isn't sufficient processing capacity, memory, or storage space on these systems. So we're stuck with compensating security controls, segmentation being one of those, right? But the first thing we need to do is to really understand what are the level of risks that each of these, well, firstly, what assets do we have? And then secondly, what risks do each of those assets present to us so that we can make conscious, well-informed decisions as to whether we need to replace $30 million X-ray machines that work perfectly well, but run on Windows XP and therefore present problems, you know, for the network. It's a shared responsibility, though, and this comes to my second point. You know, medical device manufacturers plainly have to up their game and make these things more secure and manage the life cycle of these devices better. But at the same time, we need to do a much better job of educating those people who manage those devices on our networks, our clinical engineers, our biomeds, our BMETs, right, around some of the cybersecurity risks that perhaps they don't consider in their role. And we need to do that with our nurses and our clinicians as well. And there's been, you know, a number of MDs who have taken up cybersecurity roles, particularly in California, that are set on a mission of educating physicians what to look for when a medical device fails. Christian Dameth and Jeff Tully being perhaps the best known in the space, two MDs at the University of California system, who are pioneering this particular space, but they're not alone, right? Dr. Saif Abed out of the University of London or out of the UK has been pioneering this space as well in terms of looking at how do we manage clinical risk as a result of medical devices and other devices and systems that we're bringing into our environment. This is a continually evolving space, but we need tools that are automated because we can't bring on armies of people to go around patching medical devices, right? We need to embed things like AI and ML into our technology tool chests so that we can automate the management of hundreds of thousands of discrete devices that cannot be managed by Windows Service Center, for example, as you manage your IT desktops in many hospital systems on Windows. This requires a different approach. It requires stepping outside of the box and resetting the paradigm of how we go about securing the assets that are on our network. So, watch this space.
Right, that was a great answer, Richard. And I think it's a good segue into talking about the cyber professional talent drought. You read articles and you see that the supply of available qualified security professionals isn't sufficient for what we have going on today. So how can organizations attract, hire, and retain talent at this time? And has the pandemic affected this at all, working from home, that sort of thing? Anybody can chime in. Richard?
Yeah, I'll start this off. So we have a massive deficit in the number of security professionals that work in the healthcare space, right? There's a lot of open recs, but we're not doing a very good job of attracting and retaining the right number and the right caliber of staff into our security teams in healthcare. Part of that is because we don't pay the type of prime rates that other industries pay to attract and retain cybersecurity professionals. We don't have the best budgets and tools. And to be honest, it's not sexy working in healthcare like it would be, if you're working for a major high-tech organization or a major bank, for example. According to the Cisco security reports, there is a 12x demand over supply for security professionals. And that goes back over the last 10 years. There are 12 jobs open for every available candidate to fill in cybersecurity, across industry, right? And healthcare tends to be at the lower end of the adoption rate. So our problems are exacerbated by the fact that, we don't pay as well as financial services, as an example. So we probably need to look at how do we compensate for the fact that we can't get those resources by implementing AI-based tools that reduce the need for human intervention. Secondly, we need to look at how can we change the processes, because security is a combination of people, process, and technology, right? How can we change the processes to remove some of the bureaucratic, time-consuming necessities that consume a lot of our cybersecurity teams, and how can we better govern the need for cybersecurity? And that comes back down to more effective communication to senior executives, and having senior executives prioritize the appropriate spend in order to manage down risk in our healthcare environment. And at the end of the day, security is about managing risk, right? It's about managing risks to reputation, about managing risks, financial risks to the organization. It's about managing operational risks, right, on the availability of our systems. And it's about patient safety risks, right? Keeping patients safe.
Esmond, do you have any thoughts?
So I would agree with Richard, but if I can speak a little bit selfishly, I'm very lucky to work for an organization that is investing and expanding our security staff. So if anybody currently is out there, is interested, please look me up on LinkedIn or look at our careers site for the positions that we have open or available. But what I would echo what I heard out of Richard there, I was kind of disappointed that that kind of education or skill gap wasn't directly addressed in the executive order on cybersecurity from earlier in this year. The big skilling organizations haven't really echoed the investment that the big tech companies have made. Whether you're looking at the tens of billions that your Microsofts and Apples and Googles and Amazons have promised to address cybersecurity, I would like to see the educational market also step up here. Because realistically speaking, the way cybersecurity is managed, it's really a market problem. We have some federal regulation around patient safety, but from a cybersecurity perspective, as Richard had indicated earlier, it's kind of a market condition. This obsession over function is kind of creating an instability or a debt that we have to pay down the line. So what I would encourage people to do, I'm very lucky to work in the Northeast, and there's lots of colleges and other kinds of places for education that I tap into for candidates. I also think that the change in the marketplace in association with COVID is something that you need to leverage. Now that hybrid or remote work is much more common, if that's something that you can leverage to your strength and advantage and recruit from areas and locales that you perhaps wouldn't have been available to you in the past. These are things that you need to be aware of, but you also need to change the culture. You know, when a lot of people's interaction is no longer, let's say, at the water cooler, now it's a digital Zoom conference. Zoom fatigue is real. So figure out how to address and reach out to your different demographics that comprise your staffing. Make sure that they're taking advantage of those kind of work-life balances. Also the upskilling that you make available to them. And then kind of in closing, I'd also look at relaxing some of the enforcement. So if you had particular conditions on, you know, X amount of years tenure or things of that nature, you know, in healthcare where we can't necessarily compete with the better financed or tech companies and finance and things of those nature, you know, maybe think about relaxing some of those requirements and focus on the curiosity, the skills, the passion that are going to really speak to, you know, the kind of people that you want to retain, the kind of people that you want to recruit. You know, healthcare has the ultimate return on your investment. You know, you're helping people get better, right? So if you can find people that invest in that mission, it's hopefully going to combat, you know, the mercenaries who are just going to jump ship at the first sign of an opportunity.
Yeah, I can't tell you how many times, like, you know, I walk into a network team, you know, in my daily world, and people say, well, we're not the security team. You know, we have nothing to do with security. Well, I mean, yeah, you can't find people, but, you know, you have people in your organization that are taking this approach. Everybody's job to some extent is cybersecurity, right? Every doctor has to be careful about what links they click on. You know, every network you design has to be designed in such a way that it can work with security and things like this. So I think, you know, getting that mission, you know, as part of the organizational mantra, right, so to speak, right, where it's ingrained and everybody really is part of the security team and you mean it, I think could make a big difference. You know, I think that there's not enough, like, I don't see enough rotational kind of, look how doctors are trained, right? Before they pick a specialty, they have to go through a certain amount of, you know, different types of, you know, fields before they pick the one they like. And there's not a lot of that in security. You know, I don't see a lot of that. People stay in their one silo for a lot of their career. And so I think commingling could help. And the mission focus is it. I mean, look, I'm in sales, right? Essentially, I'm bombarded every single day. And, you know, you can always chase the dollar, but you have to be connected to the actual mission. And I think that, you know, what Esmond was saying is critical. That, you know, the only way you're going to really solve the problem is if people are into what you're actually doing and they feel connected to the organization, because there's still, you know, I think certain organizations where they don't understand that cyber is an existential threat to their business models. Until you sort of get that and understand that you need to build that from the inside out of the organization, the cyber awareness, you're going to have a hard time hiring people, because it really needs to be about culture more than people.
Right. These are all great answers for our audience. I think it's really informative. And Esmond, I know we talked a little bit before about phishing education and human firewalls. So the cybersecurity culture post-COVID, has this changed any of your tactics or training?
So I think the escalation in attacks by the ransomware actors in particular, as we heard earlier, I think it was Richard said, that there's been an exponential increase in phishing attacks. So your email hygiene is now in the crosshairs of the bad guys. And there's only so much you can do from that email hygiene perspective where it gets to that human element, that human firewall. As we just heard from Michael as well, there's a huge shared responsibility, right? You need to be educating your install base, your user base, that, you know, you can't trust some of these links. You need to be a little distrustful. It's a little X-Files-ish, right? You need to go back to that mantra of you don't know who's sending you messages, you don't know who's sending you an attachment. They may be stealing your data from LinkedIn or other kinds of sources and using it against you. They may be sending you an email via your personal email account. And now you're working from home and your infrastructure controls to put like web proxy blocks may not work on a personal email. So certainly I believe the importance of your phishing education and your phishing protections have increased significantly. As a practitioner, I've seen the industry as a whole, start sampling and simulating attacks much more so than they may have done in the past. I think the importance of good education has never been more stark, so there's definitely a need for more positive reinforcement so that, at that point of interaction, when somebody may be choosing to make a risky decision, hopefully you're exercising that muscle and they know what to do. They know to do simple things like, look at the tag or the body of the message where you've embedded a banner to say it's external, be careful. Maybe they're hovering over the link to make sure, hey, it's some misspelling of the site that they were trying to go towards, or maybe they're looking at it and they're saying, hey, why would this person have sent me an attachment? And they're educated to say, you know what, I'm going to pick up the phone and call this person. I'm not going to use the information that's in that email message, which might have been Trojan. So whether that's your executives who are in the crosshairs for like whaling or a business email compromise or the relatively new vendor email compromise where they're compromising your supply chain and sending messages to your strategic staff, certainly phishing education is very, very important. What I'd add to that is the automation that I heard Richard and Michael touch upon. You need to make sure that at that point of interaction, you can shut things down, hopefully at machine speed. You also need to be aware that some of your controls are now maybe based in the cloud. And hopefully you've invested in those third-party kind of assessments so that your cloud adoption, your tool adoption, your work from home audience isn't a blind spot, that there's not a gray area and you're able to collect telemetry and you're able to like respond quickly to a phishing campaign or a phishing attack, but also that you're simulating, you're encouraging your users to develop those kinds of muscle memory so that, as I'd mentioned earlier, your insider threat is not this bad guy impersonating your users who may or may not be handing off their credentials or handing off their secret questions, their answers to secret questions. Certainly I would agree, Jeanette, that phishing education has never been more important, especially for healthcare, where we may not have that defense in depth or some of those strategic controls that you might have in other industries.
Right. So I know we're getting close on time, but I wanted to ask one more sort of big picture question that I wanted to come back to at the end about gaining C-suite support and funding for these needed improvements in this constrained financial environment. So do any of you have tips for our audience on how they can get leaders on board to improve infrastructure, staffing, operations?
Yeah, I'll give you a quick. So don't speak geek to the CEO and the board. You will come unstuck very quickly. What we need to be doing here as security leaders is framing risk and cybersecurity in business arguments, right? What is the potential cost of loss of us not acting upon these risks, not mitigating these risks? And what is the potential cost of mitigating these risks? It comes down to an equation at the end of the day, right? And at the same time, we need to be educating our C-suite, our CEO, our boards of directors on some of the cybersecurity risks that the industry is facing. And I talk to a lot of healthcare CEOs, many of whom have come up through the ranks, starting out as a physician and working their way into the CEO seat. Others that have come in from other aspects of running hospital systems or even from outside. And a lot of them just don't understand the complexity to this day, despite things being in the papers or being on the headlines on a weekly basis. It's not a priority for them to to understand cybersecurity. So the role of a security leader is to educate and make aware, so that people above, the ones with their with the budgets, can make the appropriate decisions based upon an informed understanding of the risks that they're being presented to them.
So we're pretty much at an hour, but I just want to ask each of you to perhaps share your thoughts for the next few years and any advice you'd like to give our audience today before we wrap up. Richard, do you want to start?
Yeah, be scared, be very scared, right? But no, seriously, I don't want everyone to go slash their wrists at this point. But I think we need to be aware of what's happening, right? There are some adversaries out there that are challenged from an ethics perspective. They're simply out to make money or to gain information for their own, state-run businesses. And they have no qualms about how they go about getting it. And I think we in US healthcare need to adopt a much more aggressive approach to how we go about securing our systems from those types of attacks. Whether that's an expansion of the Budapest Convention on cybersecurity, whether it's the UN Charter on cybersecurity, whether it's governments stepping up and taking more direct action against the perpetrators of these types of attacks, as we've seen in failed states like Syria, where the US has launched drone strikes against perpetrators. The IDF took out Cyber HQ of Hamas with a 1,000-pound bomb on the building. Right, I think we're going to see more kinetic responses to attacks that essentially target the lives of American citizens. We had in the press last week a baby that essentially was killed as a result of ransomware attacks. We've had a woman in Germany that died at the University of Dusseldorf Hospital that was under attack from Russian hackers. I think we've reached the point now where, let's call it what it is. This is a gray cyber war, right? Which means that we need to step up and understand the reality in which we currently live.
Right, Michael, final thoughts?
It's understanding the context, right? You're part of a business model, you're part of a political model. And once you understand that you're not being individually targeted, it should change the approach, right? That you're part of a big system, and really it's just about making money and doing, some political damage possibly. So taking, sort of the eye out of it and looking at the bigger picture is really critical. And, again, when you're making these cyber decisions, start with the simple. Start with what you can protect, what you do understand, and then work out from there. There will always be more sophisticated TTPs, but your data is still in a database someplace, and it can still be protected. So start with what and again, get the thinking outside of it. It's me, and understand you're part of that business model, political model, and everything you do will help posture against these important cycles. They're bigger than anybody, right? It's very difficult for executives to understand that they're being attacked as part of a model. It's not personal.
Right. Esmond?
So I'm not as pessimistic perhaps as some of my colleagues on the panel. I do think there are things that you can do. I think you need to map to some of these frameworks and create that defense in depth approach. I do think you need to start with socializing that culture, that prerogative that needs to permeate your entire organization. I think there are simple little things like multi-factor or endpoint hygiene, like patching your systems and having the ability to automate and move as fast as your attackers. These are things that we can do. I'm fond of a quote from Kevin Mandia, who talked about how some of these nation states are the people who are coming against us, these semi-state sponsored attackers, is a lot of them to a great extent are punching above their weight, and they're capitalizing on some of the missteps that that healthcare as an industry has introduced. So I think there's a forced maturation that we're going through right now. And I encourage you to focus on the basics, the building blocks, the measurement, the endpoint hygiene, the identity posture. You know, certainly I encourage you to look at solutions like Zero Trust and NIST CSF and other kinds of endeavors. So, you know, I think it's inexcusable, it's unforgivable to do nothing. So I encourage people to be proactive. I encourage people to step up and look at this as a challenge. You can't shelter from this kind of storm. You have to sail these stormy seas. And the outcome from this is we will hopefully at some point get ahead of the attackers. Hopefully we will be resilient and be able to contain the splash damage from their attacks. But also hopefully we will be able to limit any damage to our patients, because that specter, as Richard had indicated, is out there and it's starting to happen. And I think it's time for healthcare to embrace this challenge and step up.
Right. I really like what you all said about patient safety being number one, because that's really the business we're in. And we're out of time, but I wanted to thank each of you for being here today. And I think this was a great conversation for our audience. Thanks so much.
Thank you.